Hello to everyone. I'm Innocent Karichezi. I'm a Kepler student, and I want to take you through this presentation. So this presentation will be talking about the research that I've carried out in the last two months. I had the research topic of contribution of healthcare support services to the wellness and patient satisfactions. So basically my major focus is a Bachelor of Arts in Healthcare Management with concentration in communication. So in this slide we'll be looking on motivation, problem statement, hypothesis and objectives. We will talk about population sample size, and even sample strategy, presentation of key findings, problem identified and practical solutions, and the contribution to the skills contribution of the skills acquired to the research process, and the research conclusion, of course, and recommendations. Starting on motivation, motivation of today is the goal you decide to embark on will be easier to stick to if you put together a detailed plan. So let's first look on the problem statement. So our problem statement was we know that wellness and patient satisfaction can be evaluated or promoted by health support services. So basically we know that there are some healthcare facilities that used to send messages to the patients just to make follow-up of how they are doing, and that acts builds a relationship between healthcare providers and the patients. So the researchers who conducted the research in this field did not actually focus much on the contribution of healthcare support services to the wellness and the satisfaction of patients. So in these respects, that's the research. In this respect that my research was going to carry out, so that to evaluate that contribution of healthcare support services to the wellness of patients. Moving forward, the hypothesis and objectives of my research was, first hypothesis was the effective of healthcare support services increase the wellness and the satisfaction of patients. So the main objectives was to evaluate the contribution of healthcare support services to the wellness and the patient's satisfaction, but the specific one was to identify the healthcare support services that are being offered at facility. So to find out the level at which healthcare support services has helped the wellness and patient satisfaction, and also to assess the challenging of healthcare support services to the wellness and satisfaction of patients. Excuse me. So let's look on population sample size and the sample strategy. So my population total was 30 people, and those include patients, doctors, nurses, and auxiliary workers. The sample size was 28 people. This is the people that I used from my research, and their data or the information from them was used to draw the conclusion. Sample strategy was random sampling techniques. So what I used while selecting the sample size people, and I used what we call purposive sampling, and this strategy I used it to targeting healthcare support services providers to get specific data. So moving forward, this is the presentation of the key findings. So basically this is the demographic data. So this is the healthcare support, the healthcare providers and patients that whom I talked to. So there was the diverse of sex, where I had the women and the men. So they were aged between 15 and 40. 40% of them did their university. 30. 40 of them did the high school, and 30 did diploma. Diploma is the first the first part of university, if I can say. So this graph shows the rate at which the patients face challenging of healthcare support services to their wellness and satisfaction. So basically, it has found that women are more affected, men and children respectively. So according to discussion that I did have with the people from my sample size, they give me a scenario of women, because why the women are more affected. It's because the women, for instance, the women come at the hospital during the night, and it's found that the woman is pregnant, so they need more care, and most of the time during the night, the men, the healthcare provider, there is one healthcare provider at the facility, so like the service of frequent visit to women is affected, and this also as a service provide, like as a healthcare support services is affected. So this shows that women are more affected. The children find to be less, because most of the time they come with their parents, and they take some of the care on their behalf. So moving forward, this is what this is the level of at which healthcare support services has helped the wellness and patient satisfaction. I said frequent visit, as I said before, it's the way that healthcare providers visits the patients and check on them, how they are feeling, how they are being recovered. Home care, this is a program for the outpatients, just for the people who are suffering from home. Outreach program is the program of reaching out to the patients and see how they are doing. Like, you can call them, you can message them. That's how this service is being provided. So consumer medical education is the way that healthcare provider teaches the patients how to use the medicine that the patients receive. So the graph here basically shows the impact of healthcare support services by the number of stakeholders. So I've talked to doctors, nurses, and patients. So they have explained that we talked about the improved communications, the increase of relationship between patient and provider, healthcare provider, and improve the knowledge of patient to their medical. This is the impact, or how healthcare support services affect the patient. It increases the communication, of course. So it also increases the relationship, because when the healthcare providers, they are talking to the patient, reaching out, what in the program of, the service called frequent visits, this increases the relationship, improve the knowledge to their medication, under the service called consumer medication. So moving forward, the problem identified and the practical solution. Problem identified, it's I have seen that most of the healthcare providers do not understand the importance of healthcare support services and how it affects the patient's recovery. So the practical solution that I have found is just to understand the importance of these healthcare support services. The workshops and trainings needs to be provided to the healthcare providers, and those workshops should be organized in the way that healthcare providers will get the chance to learn more about healthcare support services and the importance of it, and how it can increase the wellness and satisfaction of the patients. So moving forward, let's see on the contribution of the skills acquired to the research. So the skills of critical thinking skills that I get from Coepla was helped me throughout my research, because I was able to think critically and found out the way to solve any challenge that I met. So technology skills helped me to draft out the reports and using charts and whatever in my reports. Research skills, this helped me throughout my way in the research, and how I can get the relevant information to my research topic, and so on. The next one is research conclusion. and the research commendation. So after carrying out research, I found that the research was conducted with the aim of identifying the importance of healthcare support services to the wellness and patient satisfaction, of course. And the research findings indicate that 8% of the patients are satisfied by the healthcare support services. This is have been done through frequent, visits, outreach program, consumer medication. So 40% from different nurses and doctors indicate that communication has improved through reach out program, and 40% indicate that relationship has increased through a frequent visit, and 55% of patients indicate their knowledge about medical has improved, of course, through consumer medical education. So with that, this is through educating, with that, the problem that identified were low understanding of healthcare providers about the importance of providing healthcare support services to the patients. It has found that most of the healthcare providers does not practically practice healthcare support services in a regular way, and it seems like they take it for granted. Therefore, the solution taken to the problem is providing workshop healthcare providers which will teaching the importance of healthcare support services and how it can help the patients to recover. The last one is recommendations. So the first one, recommendation, is for healthcare institution. So I was found out to recommend clinic La Nouvelle Trades to offer workshops for their healthcare providers frequently. The workshops that provided would explain the healthcare support services and how they are important to wellness and the satisfaction of the patients. Also, I get the recommendation to health seekers or patients. The patients are obliged to know the health care support services they need, including being educated about the use of medicine they have received. The last one is for future researchers. I recommend the future researchers to find out how the patients would be taught about health support services and research why they need them. So I would say thank you for each and everyone who supported me through actually during this presentation. Those guys who are watching, and I wish you to have a marvelous day and a new endeavor. Thank you very much.